Good evening and welcome to Sunrise TV. My name is Imran Ajay. They say when two elephants fight, it is the ground that suffers. Okay, so about the Minister of Health and the Tamale Teaching Hospital saga, at the end of the day, it's the patients who are going to suffer. But I think this is a very healthy one. No matter how we put it, whether it's a fight or whether it's an industrial clash or clash of powers or whatever, for me, I think it's a healthy one. What happened? Minister decides to go on a tour upon hearing or seeing that social media is requesting for the fixing of Tamale Teaching Hospital. So he decides to go on a surprise visit. He goes, he has an encounter with one of the head of department that came out. We all saw it. Few days later, CEO is suspended or sacked. And then the next thing, doctors of Tamale Teaching Hospital are on strike. At the end of the day, who suffers? It's the patient, the poor people. We, the Ghanaians, we are the one who suffer. But then, for me, if you ask me my general view about this whole thing, all I see is clash of powers, exhibition of ego. And that is it. And the reason I say is a healthy one is that I have seen that the minister is trying to do what he feels is the right thing, exhibiting his powers, exhibiting his authority to fix things, which is okay. We are all crying for resetting of the country. So if he feels he has to reset, it's very good. On the other hand, I also see that the doctors also feel that, look, there are things you need to do for us you have not been doing for us. We need this, we need that, we need that, we need that. We don't have, but we are trying our best. We are risking our lives, and we are doing what we are supposed to do. So if you think that you have what it takes, you have the powers it takes to come and, sack CEOs or whatever, then it's about time we also request what we need. And for me, it's very good. For me, in the short term, it's not too good for patients who are on, and then they are being nice to patients who are on admission. At least they are seeing two patients who are on admission, but they will not take in new patients. For now, let's all suffer it. But if this is how it's going to be, then it's going to be very good, because we've heard, if you have doctor friends, you have health workers, you hear things like ya can't this way ya can't. Who have they been saying these things to, and who is not working, who is not responding? Possibly the government. So if now government thinks that it's okay to sack people for not doing what they are supposed to do, then the doctors also have what it takes to say that if you don't give us this, then we are not going to work, which is a very good one. I don't know the grounds on which the CEO was sacked. Initially, I thought it was the Dr. Valentine who had a confrontation with the minister who was sacked. But according to an interview I watched by the Tamale MP, he said they don't have any issue with the said doctor because they feel he has not done anything. That is fine. Then, on what grounds was the CEO sacked? When I was watching the earlier video, even before this whole sacking thing, there was a point I saw, and all I saw was the MRI is not working. And I said, really? MRI is not working? I don't know what, if you have had an encounter where you have to go for a test using the MRI. That is expensive. Most of the times you have to go to the private facility. So if there's one in the government hospital, it should be cheaper. So I don't know why it's not working. But I spoke to a doctor friend. He told me, look, that is not an easy fix. It's not something you can easily fix. It's expensive to fix. And possibly the hospital might have called on the powers that be and nobody's responding. So I don't know the grounds on which the CEO is being sacked. I was even thinking it was about a confrontation. But if it's not about a confrontation and the CEO is being sacked for things they feel that he should have done, but he's not doing, then fair enough. But then my question is, why are the doctors on strike? Because the CEO has been sacked? Or they feel that they have become untouchable? If that is the case, then it's dangerous for us. You don't just go on strike because one of your colleagues has been sacked. If the right approach is not used, I'm not sure immediate suspension of your duties is the necessary thing to do when life is at stake, when lives are at stake. You get it? But if you make it look like call him back, apologize, and blah blah blah, otherwise you are going on strike, then you are making it look like now doctors are untouchable. There have been several issues, there have been several instances where doctors have, people have lost, they use their attempts, bodies have expired as a result of negligence from doctors. What has happened? Nothing. It's the same government, and that is why I am happy that this thing is happening. Because when these things happen and the family members call and they go to court and blah blah blah, we don't hear anything. It's because the government doesn't do anything about it. So the doctors also have their way. So if now there is that kind of industrial clash, that kind of clash of powers, then it's cool. Let everybody show their clash of powers. But please do it with some kind of conscience. Know that you have lives to save. Life is not mangoes that you will be selecting and then you see that this one is not away and you then you throw it away. This is life we are talking about. So fair. I just don't like the confrontation between the minister and the said doctor, the HOD. I think it was just an exhibition of ego. The doctor feels this is my office. You can't come and intimidate me. The minister also feels, because at the point you hear the minister saying, even if me, this is how you are talking to me. So at least the minister also feels that, look, I'm your boss. I'm boss. The doctor also feels, look, this is my office. And I can tell you, a lot of doctors are not happy. A lot of doctors are not happy with their salaries. As for that one, is the bottom line. The bottom line is that most doctors are not happy with their salaries. They feel they are more qualified than the salary they are taking. So already they are doing sacrificial work. And beyond the sacrificial work, they are not materials. The things, basic things they need to work, the things are not coming. So they are sacrificing. Their lives are at risk. They are managing. The tools are not there, but they are managing. And they are not calling the politicians out. So why should the minister make it look like? But then, if the interview I watched from the Tamale MP saying that the HOD said, I don't know why this thing should be blown out of proportion. I think that is a bad PR. This is life we are talking about. Maybe you have seen different types of deaths and so many deaths, and just like we kill cockroaches in our house and it's no news. That cockroach, I'm sure the family will be organizing a funeral because they have lost a breadwinner or something, but we just kill the cockroach and it's normal. So yes, to you too, life is lost, it's normal. For you to say that, according to the minister, for you to say that, why should this thing be blown out of proportion? It should be. This is life we are talking about. This is not a mosquito that is there. This is human being. So if you make it look like it's no big deal, to me, it doesn't make a lot of sense. And from both sides, both of them did not exhibit proper PR. Both of them did not exhibit emotional intelligence. No, it's like everybody was just trying to. I feel the minister had heard a lot. So all corner, when I say, you bet chromo, you bet chomo fili. And the HOD is also feeling like, Masa, things you are supposed to do, you are not doing for us. Recently, it was said that 2 billion or so, 200,000 amount of money was given to ministers, and about 75% was given to them for monitoring. Look, all these things are things that is, going on in the mind of people. People are not happy with all these things. They feel you should give us equipment to work with. You are not giving us. Our salaries are not up to. So there is a lot of pain in the system. And for me, like I said, this is good. Let's see how it goes. I just pray that they will not go and smoke the peace pipe and try to cover each other or scratch each other's back. Let the ministry be firm. Do what you are supposed to do. Sack who you are supposed to sack. Doctors, request for what you are supposed to request for. If you don't get it, call out names. Why is MRI not working? Who is supposed to fix it? Who is supposed to bring the money? Has any letter been written? Has there been any official complaint? All these things are things that we need to know, so that it doesn't look like we are just exhibiting powers to see who is who knows more than who is more powerful than who. So please, let us as a nation come together and back this fight. It's a good one. It's a very positive fight. Maybe so far the only positive fight I have seen. Let's see. Let the doctors call out the politicians to do what they are supposed to do. Let the politicians also hold doctors accountable, so that if a doctor out of negligence kills a patient and you want to send it to court, nobody is covering anybody, so that the system will be free. I think it's a fair one. It's a very good one. But doctors, please, one thing I want you to put in your mind, that don't make it look like you're untouchable. When you come to Accra to visit your families and you are going back to Tamale, it's not always that you drive. Sometimes you take buses, and the driver that drives you is also serving you at a point. If you also misbehave or he also does anything out of negligence, you also die. So don't make it look like doctors are untouchable. So because one of yours has been suspended, so you're also going on strike. No, everybody is serving somebody at any point in time. So in execution of our powers and showing who we are and what we can do, yeah, it's cool, but let us show empathy to a large extent. Let us not just make it like, clash of power, and let's show who is who and all that. Yes. As for the system, I'm sure nobody is 100% happy. It's almost like everybody's managing the situation some way, somehow. Even doctors that people are dying to become, the doctors themselves, most of them are not happy, especially with their salaries and condition of service and all that. So they also feel they are doing it. But at the end of the day, let us work with empathy for the love of Mother Ghana. This is Sunrise TV.